employment attorney, primary member of our labor and employment practice group here at Foley. I've been an employment attorney for almost 10 years. I've got extensive experience in OSHA, ADA, medical leave, and any number of other issues involving our workforces, primarily helping employers. Basically, my practice entails, among a lot of other things, but for purposes of what we're doing here today, a lot of helping employers stay out of the courtroom and defending them when they do inevitably get hauled into one. So that's kind of what my background is. And we'll talk about a number of employment issues today, focusing on one particular type of issue. And, you know, we're all here today as employers dealing with unprecedented issues, risks, and liability associated with this COVID-19 pandemic that we're all experiencing together. Today, we're focusing on one of the key risks that I'm seeing that employers are facing in their workforce, and that's how to address employee fears surrounding the pandemic. But we all have to remember that at this critical time, guidelines and best practices are constantly changing. They need to be revamped. They have to be retooled to address specific factual scenarios, things like that. And government agencies have issued guidance in some places, and in some circumstances, we're dealing with new laws that we haven't seen before, like the Families First Coronavirus Response Act. So this presentation won't be an exhaustive analysis of all of the various state, local, federal laws that, and ordinances that might potentially be in play. Those are all frequently changing in the fluid environment, but this presentation will be a starting place for you to create and update your policies, your practices, develop some ideas, kind of start the communication process to deal with this, tough issue of employee fear in the workplace, what it's founded on. As always, to the extent you're not one of these individuals, you should be working with your senior managers, your employment counsel. If you don't have one, potentially work with your senior management to find one when making decisions and implementing these policies to address these tough and complicated analyses and issues. So, what exactly is it that employees are afraid of, and employers for that matter? And we basically know the answer to that in general terms: getting COVID-19, giving COVID-19 to family members and friends, and for those truly altruistic employees out there, making sure we're all doing our part to flatten the curve or keep it flat. But what we may be missing, and what will kind of guide our discussion here today, is why do we have those fears? And our employees might be afraid because of a perceived lack of safety measures taken by their employers in the workplace, age-related medical or health considerations, pre-existing medical conditions, regardless of age, and certain financial considerations. So that's going to kind of guide our analysis here today. But one thing I want to first start with, and this is going to be kind of the guiding principle here, is that can an employee simply tell you to shove it when you ask them to come back to work? And the answer is a very general no, they can't. But, there's a but here, because I'm a lawyer and but is among my favorite words. And there are a lot of exceptions and caveats to that general rule. There's a lot of factual scenarios, a lot of circumstances in place, and of course, a lot of laws that afford employees certain rights that employers must be mindful of. So what are some of these rights that are in play? So we're going to talk about some of these. We're going to talk about the Occupational Safety and Health Act and some regulations. We're going to talk about the Americans with Disabilities Act. We're going to talk about the Families First Coronavirus Response Act, the FFCRA, you might hear me refer to it as, and in a very general sense, some state-level employment law concepts, because that's kind of becoming that's coming into play a little bit. And as a heads up, you'll see some blue underlined font here in the slides. Those are links. And my intent is that for anyone who is interested in or a glutton for punishment in reading some of this stuff, as the case may be, you can shoot me and my assistant an email after the webinar today, anytime, and we'll send you these slides with the links that you can use for this source material and some other materials that Foley and Lardner has prepared for your future reference. In a later slide towards the end of the presentation, I'll give you the email addresses for you to use for that purpose. So without further ado, let's just kind of, step into it. And the first of these considerations, which I personally think is among the most important for risk and liability reduction when it comes to this important consideration of dealing with employee fears amidst the pandemic, and that is workplace safety considerations. Simply put, workers cannot, in general, workers don't have a general right to just say, no, I'm not coming back to work. But as a last resort, if they can establish several factual elements, maybe they can. And those elements have been established by the Occupational Safety and Health Act, the OSHA, Occupational Safety and Health Administration. And that is, if the employee has made you, as the employer, aware of a safety hazard, but you've not done anything about it, and if the employee believes in good faith that there is imminent danger in the workplace, and a reasonable person would agree that there is a real danger, and there's no time for OSHA to get involved through its usual avenues like an inspection or a notice of alleged hazard. But frankly, this test, I mean, to me, leaves a lot to be desired in terms of providing certainty to you as employers trying to navigate and manage these sorts of risks in the workplace. I mean, what does reasonable mean? What does in good faith mean in this crazy COVID-19 world? What is imminent danger or real danger, where up to 25% of people with COVID-19 are completely asymptomatic? So what does all this stuff mean? And you, as the employer, can help answer this question with the right information, and the key here, documentation. So let's go to the next slide. And what can you do as an employer to help manage this risk, right? And these tips will kind of flow down and help you manage a lot of other aspects under the law, employee morale, messaging to your employees. So this is kind of forming the base of how you respond to this. And the first thing you can do is implement kind of the best practices and steps that are up here on this slide. I think one of the most important things employers need to do to assess what employees is to assess what employees do, and how and where. And by that, I mean, what are their job duties? How do they do them? Where are they doing them? Are they working with other people? Figure out the risk level of your employees getting COVID-19. And OSHA has a very nifty pyramid diagram. It's called OSHA document 3992.03. I can send you a link to that. We have some information about that in the Foley Coronavirus Resource Center to help with this. And it has recommendation and guidance that OSHA has put out, not specific regulations and laws, mind you, but guidance for PPE and safety measures depending on the employee risk of COVID-19 in the workplace. Frankly, most of your employees on the golf course are going to be in the low or medium risk categories. And low and medium risk employees are those with whose duties don't require contact with people known to be or suspected of being infected. Medium risk employees, exposure risk employees are those like school employees, high population density work environments, some high volume retail settings, things like that. So most of your folks are going to fit in that low to medium exposure risk category. High and very high, just for your information, are essentially healthcare and morgue workers performing duties that we all know bring them into contact with known or suspected cases of COVID-19. We're going to set those aside, and we're going to focus on the low and medium exposure risk. So putting your employees into the appropriate category will then flow into what safety measures you ought to be taking to protect them. And generally, you should be instructing your employees to have proper sanitation and hygiene. Wash their hands for 20 seconds. Use hand sanitizer regularly. Don't come to work when you're sick. Provide them face coverings and gloves and gowns or respirators where appropriate. And keep in mind, though, and a couple of things that while a lot of these sorts of best practices are based on OSHA guidance and not necessarily OSHA regulations or laws, there may be some OSHA laws and requirements that you have to implement depending on what you do. So for example, if you're giving your employees N95s, these fancy masks that mostly, the healthcare workers and things like, some employees might need depending on their job duties, there are various regulatory requirements, fit testing, training, things like that that you have to keep in mind. Probably most of your folks don't need or required to use N95s. And in fact, OSHA has flat out said N95s just aren't even recommended for those in the low exposure risk category. So in addition to that, so you've got PPE. In addition to that, you should be considering various administrative and engineering controls. And I think this is really what's most important for folks on the golf course. We're all in the open air. Probably PPE isn't as big of a consideration, but what sorts of things can we do to change the way we're having our players come to the golf course, having our employees come to work and interact with the players? What can we do to protect our employees on the golf course? Physical partitions and barriers in the pro shop or in the driving range between players and staff members. Staggered tee times to limit player access and interactions with staff. Staggered employee shifts to limit employee interactions with each other. Temporary shutdown or postponement of non-essential activities and work, like limiting landscaping that would just do something like alter holes, like, maybe leave the landscaping where it is for a while, leave the holes where they are for a while so we kind of get on the other side of this. Require appropriate social distancing. Things like this are administrative and engineering controls that you can implement, and be flexible and creative with this sort of stuff. And of course, if the employee raises a safety concern or requests some sort of administrative or engineering control in particular, address that concern. If it's something you can do, you think it's a good idea, do it. If it's not something you can do, if it's something that would, fundamentally alter the way you're doing business and not really help the situation, or even worse, create an even worse hazard, then that's something you got to monitor. But the most important aspect of all of these steps is to document what you're doing and what you're considering. And the reason is you're just not going to get very far by retroactively kind of telling OSHA, well, we did this and that and this and that. OSHA in these times has taken an oddly kind of practical approach to dealing with employers in this situation. And that is, if you're acting in good faith, they're going to give you a little bit of leeway, because a lot of this is guidance. So how do you demonstrate your good faith? You show it with contemporaneous documentation. If nothing else that you take away from today's webinar, hear that. Document your good faith efforts to create a safe workplace. That matters to your employees. It matters to OSHA, to personal injury attorneys, to juries, to judges. Notices of alleged hazards are probably going to be how OSHA is dealing with this for a while, as opposed to on-site visits. It's a typical method to dealing with current employees in the low or medium exposure categories. So if you can show all of your documented efforts, you can likely stave off further OSHA disruption with an on-site visit and feel comfortable that you've created a safe work environment. You can also message that to your employees a lot better, make them feel comfortable coming back to work. And frankly, by doing all of this, you can stave off a lot of what what we're going to talk about the rest of today. So document. It's very important to make sure you're doing all of this. Why are you doing one thing versus another? Things like that. So with that, let's kind of go into the second piece of this. Inevitably, you're going to have situations where an employee is gonna be fearful, not because you haven't done something, but because of something personal to themselves. And that's where we get into this concept of a disability. And under the ADA, a disability is a physical or mental impairment that substantially limits one or more major life activities of an individual. Well, what does that mean? We can kind of get into that, but major life activities, seeing, hearing, working, things like that are major life activities. So then we have a record of such an impairment. Do they have a doctor's note that says they've got something? Do we think they have something? That's regarded as. We're not going to get into the nuances of the ADA here today. I just wanted to flag this for you that, the ADA, keep in mind that it only applies to employers with 20 or more employees. So there may be some state disability discrimination laws that may be specifically applicable, or they may apply in addition to the federal ADA. Those laws may define disability differently, perhaps even more broadly. New York and California, great examples of that. Of course, California, or there may be different requirements and considerations depending on where you are. Like in Wisconsin, where there's a clemency and forbearance requirement that may be broader than the reasonable accommodation requirement under the ADA. So, because people are different, they may have different needs, different life circumstances, medical and otherwise. So this is a highly factual inquiry into whether somebody has a disability that requires a reasonable accommodation. Then you should definitely be involving your senior management, your HR if you have that, employment counsel if you have that, in these sticky situations involving COVID-19. And that's because fear in and of itself is not really a disability. You can't just say, well, I'm afraid of COVID-19. I mean, we're all afraid of COVID-19, right? That doesn't give us give us a covered disability under the federal ADA or its state counterparts. But what about the situation where we have a pre-existing or an age-related physical impairment like asthma or diabetes or heart conditions, which the CDC says puts a person at a higher risk? Or what about where the fear is a manifestation or a symptom of a mental impairment like generalized anxiety disorder, agoraphobia, or the like? These are all things that could very well be covered disabilities that require accommodation, a reasonable accommodation. The EEOC recently said as much. Over like the past week, they put out some new guidance that said, yeah, you got to be having these conversations. You have to be thinking through these issues. Somebody comes to you, you have reason to believe that they've got, physical and mental impairment that puts them at a higher risk. And if so, you have to do a few things. So as an employer, what are those things you have to do? First, you got to remember, and this is important, the ADA has restrictions on what you can ask and what you can say. Ask about symptoms. Ask about job-related restrictions. What can they do and what can they not do because of this alleged disability? You don't ask them, well, what do you have? Are you sick with this or that particular condition? You don't ask them that. You ask them about their symptoms. And that is true even for COVID-19, according to the EEOC. You ask about typical COVID-19 symptoms that, like fever and cough and things like that, and make appropriate decisions based on your answer. So second, under the ADA, and we'll talk about the FFCRA separately for paid leave, but under the ADA, you can ask for a doctor's note or some sort of documentation about their job-related restrictions. That's pretty common. But the reality in this COVID-19 nightmare that we're all living right now is that a lot of doctors are backlogged or they're only seeing patients via video chat. So be flexible in what, the documentation you're requesting about their restrictions. And keep in mind that the documentation that can be requested, as I mentioned earlier, is different than the documentation that can be requested and the information that you're allowed to ask for under the FFCRA. We'll get to that in a little bit. Third, if they have restrictions on what duties they can or can't do or things they need to be altered, engage in a dialogue with them, communicate with them about what it is and how you as the employer can help them complete the essential functions of their job. This is called the interactive dialogue. You might have heard that buzzword before. And it's just like it sounds. It's an open, flexible, back and forth communications about what the restrictions are, what may help them in their restrictions. Be understanding, be a good listener. Fourth, if the employee requests you to do something you can do it. It's generally easy enough to allow a lot of our admin workers to telecommute, to work from home. If all they're doing is payroll or something like that, consider that. Consider allowing them to continue to do that as a reasonable accommodation. That does a couple of things, right? It addresses their specific potential or alleged mental or physical impairment about coming into work, but it also is what? It's an administrative or an engineering control that allows you to limit that person's interactions with other employees. So you got a couple of different things that you can do there. But if they simply say, look, I'm afraid. I want to stay home. I'm bunkered down indefinitely until all this mess clears up. I've got a storm shelter. I'm just going to stay down there till those, that's usually not required, indefinite unpaid leave, or, but it's got its own set of limitations and exclusions that you've got to go through depending on the state you're in. But think through the issue of what is an undue hardship for you as a business. If they're asking, for something that you can't do, or that would put you out of business, or that it's not going to let them, do the essential functions of their job, you're not necessarily required to do it, but be open and flexible in these communications. And as always, I'm going to hit on this a couple more times today. Document your dialogue and your considerations. Document what the employee asked for. Document why you provided it, or at least offer a specific accommodation. Document why you can't provide the exact accommodation requested by the employee because it's an undue hardship on your business, and why it's an undue hardship. That'll help you prove your case down the road if you ever get called to the mat for it. And that brings us into the paid leave aspect of this, because this is going to kind of overlap a little bit. The ADA doesn't necessarily require paid leave. I mean, certainly keep in mind employer policies are one thing. We're not going to get into those. They're very specific to your business. But the aspect of paid leave kind of overlaps with the ADA reasonable accommodations a bit. And unfortunately, we can't leave this topic out of this discussion. But the concept of required paid leave is just a highly nuanced, complicated onion that we all have to peel, given the current reality of our circumstances and where we are. And you've got federal statutes, state laws, local ordinances, individual employer policies that all have their own requirements for paid leave, different notice requirements, different qualifying reasons. Well, and under federal law, you may be able to take it for one reason, but under, state law, you wouldn't necessarily have that reason. So which one applies? And so we're going to talk about some of that here today. Let's start with the FFCRA. I think that's kind of what's fresh on everybody's mind. It's pretty broadly applicable. I would imagine it would be broadly applicable to a lot of the golf courses out there. Unless you're just a big monster golf course, got more than 500 employees working for you. But employers have to provide paid leave for any number of reasons, but I'm going to focus on one here today because I think it's especially important to employee fear about coming back to work, because they've got, they're an older worker and they've got age-related health considerations, or they've got a pre-existing condition. And that is, you have to provide paid leave if the employee has been advised by a health care provider to self-quarantine. Here's the key, very broad, flexible language, due to concerns related to COVID-19. And what does that mean? And the DOL, the United States Department of Labor, has told us concerns related to language makes this kind of tough in the current topic. And it can be an employee who is particularly vulnerable. That's a buzz phrase there, particularly vulnerable to COVID-19. Maybe those folks with age-related health considerations, pre-existing conditions, that the CDC or certain state agencies have said are higher risk individuals. And, as straightforward as that sounds, not really, many states and counties, I'm going to complicate this even more, and cities have their own paid leave laws that don't require any reason at all. So take Nevada. As of January 1, you don't have to have a reason to take paid leave in Nevada, assuming you give appropriate notice and you have a sufficient accrual of the paid leave. San Bernardino County, New Mexico goes into effect July 1st of this year. Same deal. Maine goes into effect January 1, 2021. I know that sounds like a long way off, but who knows where we'll be in January of next year. So you may be dealing with this if you've got a golf course up there. So these sorts of things, they might have requirements that you've got to meet in addition to or in lieu of the other requirements. So you've got to be familiar with all of those laws. So how do you do that, right? Like how do you possibly manage this myriad of this maze of paid leave considerations? And this slide that I've got up here now kind of gives you a starting place, at least under the FFCRA. Again, note there's other state and local laws that may apply to your golf course. Certain your own policies may need to be come into play here. The FFCRA may require you to provide a certain amount of leave to an employee up to 80 hours. If the employee's healthcare provider has advised him to stay home because they're particularly vulnerable to COVID-19. So what does that mean here? Consider whether teleworking is an option. If it is, maybe your admin staff, for example, they probably don't need paid leave. If they can work from home, you don't have to give them paid leave if they're working from home. But consider, as we mentioned earlier, consider letting them work from home as an ADA accommodation. Let's see, does an employee have sufficient paid leave available to them? Well, under the FFCRA, they get up to 80 hours total per employee, but that 80 hours doesn't start over when the employee goes to a new employer either. So if you hire somebody from another golf course and they were given 40 hours of paid leave, they only have 40 more hours left at your as your employee. And you can and you should ask your new employees requesting paid leave under the FFCRA whether they've used any of those 80 hours at prior employers. And again, even if the employee has run out of the 80 hours, consider providing them unpaid leave as a reasonable accommodation under the ADA. Third, has the employee provided you appropriate notice? Under the FFCRA, you can establish reasonable notice procedures and require quote unquote notice as soon as practicable, provided that you can't require notice before the first work day or portion thereof that the employee misses. That's kind of the limit on this. And keep in mind, oral notice is okay according to U.S. Department of Labor, but for your own internal documentation purposes, you should be documenting these oral requests and the reason they're doing that they're asking for it, how long, things like that. We'll get into that in a second. And that is, has the employee provided you appropriate information? If they've called you on the phone, they've texted their supervisor, whatever procedure that they've done, have they given you the information you need to determine whether they're qualified for leave under the FFCRA or any of these other number of state and local laws? The FFCRA allows you to seek sufficient information to make your determination that it's a qualifying reason for leave. Specifically, you can request the employee's name, dates of requested leave, a statement of the reason they're relying on for their request, a statement that the employee is unable to work or telework due to that specified reason that they're asking for paid time off, and the name of the healthcare provider who advised the employee to stay home because he or she is particularly vulnerable to COVID-19. You cannot ask necessarily for a doctor's note saying, specifically for it. There's some flexibility with that. We're not going to get into the nuances today, but generally those items are what you can request. You can ask them verbally, tell me what this stuff is. You write it down, create a log so that you can then claim your tax credit down the road. And that's important. Document this request, document the reason for it so that you as the employer can get your tax credit under the FFCRA and show that you've met your obligations under the FFCRA. So again, documentation is the key in all of this sort of stuff to protect yourself down the road and reduce your risks of liability. I'm not going to spend a lot of time today on unemployment, but it's important to note, I think, because employees may be coming in, they're reading stuff online, people are Googling, what to do, and there's a lot of information out there. An employee may come to you and say, look, my state government allows me to refuse to return to work because they read something online that said that. And that may not be quite right. And again, different states say different things and allow different things, so I'm not going to get into that. But one thing that they may be thinking about here is unemployment. There are places, Texas and North Carolina, for example, you can refuse to come back to work and still collect unemployment if you're high risk or living with a high risk individual, among other reasons. Texas Texas state agency has its own definition of that. It's pretty close. It mirrors the CDC definition of what high risk is. North Carolina actually refers to the CDC definition of high risk. So that may be what they're referring to for that. Vermont, another example where you can still refuse to come into work, maybe collect unemployment if there's an unreasonable risk of COVID-19 exposure at your workplace, among other reasons. So there are different state laws out there that may allow them to stay home and say, look, I'm not coming back to work. They can still get unemployment. But generally, even if that's true, they can still get unemployment. Employers can still terminate if they just don't come back to work, subject to the other laws and caveats we've talked about here today under OSHA, under the ADA, under paid leave requirements, all of those sorts of things, considerations among others. You got to keep that stuff in mind before you just go, you don't want to come back? Well, too bad, you're fired. And you got to kind of run through the analysis to protect yourself down the road. So, we've covered a lot of material here today. And there's a few ways we can kind of sum this up, right? What are some things you want to do? I've thrown a lot of information at you. The key takeaways are be understanding of your employees and their concerns. I mean, these times are unprecedented. People are afraid, employers and employees alike. Their families are afraid, their friends are afraid. People are social beings. We're all human beings, and let's understand that we're in this together. Sometimes employees just need to be heard to feel less afraid and more comfortable. Your job as the employer may just be listening to them and helping them work through that issue, and telling them, here's all the things I've done to protect you. Is there anything that you think we might implement for your particular job? Kind of depending on the situation, you might have that sort of dialogue. Communicate with your employees. Tell them what you're doing. Like I said, listen to them if they have suggestions or additional measures. Be creative and flexible. There's a reason the government is putting a lot of guidance out there right now and only some of the hard and fast rules and laws. And that is because the reality is every workplace is different. Every employee and their job duties are different. The way they do them is different. As the employer, you're in a unique position to know your employees and what they do for you and make appropriate decisions in light of that unique knowledge. In skipping down a bit, don't ignore, though, that government advice and guidance, even if it's not an actual law or rule. It's there for a reason, and it can have helpful information for you. Fourth, document your safety efforts, your communications with your employees, your reasonable accommodations, your undue hardships that prevent you from making a specified accommodation, your employees' qualifying reasons for leave, etc. Document, document, document. This is the first line in your defense if you get sued later, or if OSHA comes knocking, or you get a nasty gram from a plaintiff's attorney saying you did something wrong. Then you have your documentation, your ducks in a row, and it's real easy to articulate and have a consistent defense. And that brings us to involving, again, your senior managers and legal counsel in your decisions and strategies. This ensures that consistent, pragmatic approach to all of these unique situations. Make sure your top-level managers are involved. Make sure your employment counsel, if you have one, is involved and has helped you walk through these considerations, the risks associated, best practices for each. If you don't have one, consider engaging one. Lastly, don't be intimidated, though. There are a lot of rules, there's a lot of regulations, a lot of laws. We've talked about a lot of that here today. It's rapidly changing, it's developing over time, but that doesn't mean you need to be afraid to run your business. If your employees are at will, you have rights as an employer too, including the right to terminate their employment if they come back to work. Again, subject to the caveats and considerations and other rules that may apply, but with that in mind, some terminations are riskier than others. They may lead to liability, they may not, but you've got to kind of run through those considerations, which is what we've been talking about here today, how to reduce those risks. Note, for those of you in Minnesota, not sure if there are any but I'm leaving them out. It's the only state I'm aware of in the U.S. that doesn't have a true at-will, not Minnesota, Montana has a true at-will employment system. We can talk about that offline. additional resources. I've thrown up some additional places you can go if you need further information about COVID-19, about your obligations as an employer or as a business, some things for you. There's a lot of great stuff in these places, including an article I wrote on the topic that we've been talking about here today, which is up on Foley's Coronavirus Resource Center. Again, these have all the links. And as I noted, if you're interested, you can email me at tewhite@foley.com, as well as my assistant, Claudia Salcedo, at csaucedo@foley.com. And we'll send you a copy of these slides with the links, as well as the current iteration of the index of all the articles and materials Foley has up on its Coronavirus Resource Center. It's just got some great stuff up there. So I want to thank everybody for their time today. If there are some questions, I think Dave mentioned that you can put up some questions using the Q&A feature. I hope you found this worthwhile. I don't see any questions currently on the Q&A feature. If you have questions, feel free to submit them up there. You can submit them to Dave. And as noted, if you want these slides or some additional materials, please feel free to email me at the information I provided. So again, thank you very much for your time today. I am seeing one question here. Let me take a quick look. Yeah, so the question that just came in is, in the event of a group of employees in one department exposed or positive, is it ever a good idea to perform on-site testing, or instead encourage each to get tested via their own medical provider? And, I'll answer that kind of generally. Because all circumstances are kind of different. So I want to add that caveat there, depending on how close everybody's working, how is together, are these two departments, do they have overlapping employees? Are they working together? Different types of protocols can be developed, and I can help you develop that if you're interested in doing that. But in a general sense, you can certainly, employers can require testing and things like that. The EEOC has some guidance on that purpose. But if you're thinking about doing on-site testing, you got to remember, you got to have a qualified individual, a nurse, a doctor, something like that, who knows how to do this testing. You've got to have appropriate PPE. Personally, depending on your level of sophistication, it might just be a procedural nightmare, an administrative nightmare to meet all of the requirements to do that testing. And so with that, there may be certain things that, certain protocols that we can help you develop to address different situations. Because there's a situation of, well, if it's a suspected case, you do things a little bit differently versus we know this person has COVID-19 versus we think that they may have been exposed to somebody. So there's different protocols there. So I'll kind of leave it at that because it's a little bit nuanced and caveat. Again, so there's another question coming in about whether there's even if it's not a requirement, would you recommend taking employee temperatures, like a forehead thermometer or something like that? And again, a lot of employers are doing this if they have the means to do it. It's not necessarily wrong to do it. You don't have to do it. But again, you've got to have somebody who's qualified to do it. You've got to realize that there are limitations to it. You might have some false positives, in which case, does that get into a regarded as type of ADA claim? If you're saying, oh, well, you've got a temperature, go home. Well, no, I'm not. I want to be here today. I want to work. So, So there are a number of considerations that go along with that you kind of have to work through as you think about whether it's a good idea to perform the testing. One thing you can do is have certain disclosures for your employees. Have you had a temperature in the last 72 hours? Have you come in contact with anybody with COVID-19? Have you traveled to any place known to be COVID-19 hotbed? You can do disclosures like that in lieu of some of the testing. another question that's come in is, what are some general return to work requirements? And I'm not entirely sure the scope of that question, but in terms of your employees, the requirements really kind of depend on what what employees we're talking about. We've talked about some of those considerations, best practices here today, and what you can do. The first thing I would do, if you currently don't have employees on site, you're thinking about having them brought in on site, run through that list of best practices under the OSHA slide that we talked about earlier. Assess the exposure risk that your employees have, document that assessment, figure out, your employees that are most exposed and what. Can some of your folks work from home? Can you have staggered work shifts? Can you provide certain PPE, face coverings, for example? Make sure your face coverings are supported by the CDC. Have you done a deep cleaning of your facilities? Have you come in? Do you have appropriate amounts of hand sanitizer? Do you have hand washing stations ready to go with appropriate, soap and things like that available? You've got to make sure you've kind of run through those sorts of things. So in terms of what we're talking about here today, I think that's the kind of the best way I can answer that. Okay. So the clarification is, if somebody was tested positive for COVID-19 and is returning to work, the EEOC has kind of answered that question for you, and that is, you can require them to have a fitness to return to work exam and submit that. But my encouragement to you, if you have this situation, so you got an employee, it's hey, look, I tested positive. I went to my doctor. They said I'm good to go. Okay, well, give me a doctor's note that says you're fit to return to work. Be flexible, though. Let them do a telehealth meeting and get a doctor's note based on that meeting, and then that will kind of cut the doctors some slack instead of having to see them. It will keep your employee from having to go back into a doctor's office where they may have treated other COVID-19 patients and potentially contracting it again. And I don't know if that's possible. Who knows? But that's something to consider. You can absolutely require return to work or a fitness for duty exam. So I think that is all the time we have for questions today. Again, feel free to email me, and I'm happy to send you the slides. And thank you for having me today, and thank you for listening.